Right. Okay. So I'd like to congratulate all of your attendees for staying all the way to the end of the conference, because this is my last talk, and I've been tasked to give this talk on how can we utilize technology in Ramadan-focused diabetes education. So basically, I'm bringing you back to why you are here in the first place. How are you going to apply this to the patient when you next see the patient tomorrow, or maybe for some of you running clinics even later today? So first, I have nothing to declare with regards to conflict of interest for this talk. So my outline will be basically just doing a recap of pre-Ramadan education, targets, timing, key components, as well as how do you utilize technology for targeted delivery for each individual patient. So let's talk about the benefits in brief. So we know that Ramadan-focused patient education, you would have heard from the various speakers, actually improves your glycemic control, not just during Ramadan, potentially after as well. It results in better self-monitoring of glucose and treatment regimen, as you have heard from Dr. Esther Yeo. It can result in sustained motivation in adhering to guidance, as well as greater self-empowerment during fasting in Ramadan, and also beyond that. So this is just one of the many systemic studies and meta-analysis which is now available, increasing more so, which actually showed that there is a reduction of glycemic control during Ramadan period when there is pre-Ramadan education given to the patients prior to Ramadan period. So we also have shown previously that the sustained glycemic control can be up to 2 years in the follow-up data that we had for our patients. So who do we target for this pre-Ramadan education? We are well aware that diabetes is basically what is a lifestyle for a lot of our patients. So not just healthcare professionals, the people with diabetes do interact with the general public, and these are the support network, which needs to help the patients in maneuvering their day-to-day life. So what kind of support can we give the patients, not just during our clinics, but also remotely via helplines, telephone, and of course, there are various other means available now, right? And in the general public, the community leaders, as well as the community support network. So when we talk about patient education, we're actually not just referring to the people with diabetes, but especially so in the developed world, in countries like Singapore, where there's an aging population, in the widespread, increasingly younger diabetes patients, you do need to ensure that the caregivers, families, and caregivers, I'm not just referring to family alone, but also in the community, the support network in the schools, and all the other institutions, the homes, they all need to be on the same page regarding how they're going to support these patients. So our education needs to be a lot more extensive than just involving our patients and families. So let's talk about when is the best timing. You may have heard from Prof. Abdul Jabbar and also a lot of the other speakers reiterating and emphasizing again and again that pre-Ramadan assessment is not just actually limited to 6 to 8 weeks prior to Ramadan period. It is actually an ongoing conversation, which means that if you need to improve the patient's glycemic control, risk stratification, it will not be able to be possible just overnight over the 6 to 8 weeks prior to Ramadan. It needs to be something that continues from the prior Ramadan and Ramadan before, all the way to the subsequent ones, which is why not just the pre-Ramadan assessment is important, the ongoing review right after the pre-Ramadan assessment all the way throughout Ramadan, as well as the post-Ramadan review is actually important in all our patients. And this can actually be the best time to encourage them to further empower themselves with regards to not just managing acute complications during Ramadan period, but also longer-term complications and outcomes. At the same time, during this period, during the pre-Ramadan assessment all the way to the post-Ramadan review, there can be, you can actually explore what are the other possible factors that potentially, if there are more and more data that suggests that these actually important. These can subsequently be evaluated as part of the literature to see whether these factors are necessary in evaluating patients as part of the risk stratification. So what are the key components? I'm sure all of you are well aware, and we have multiple talks going into the details of each of the key components. So first and foremost, we do need to involve the patient in the discussion. I think Dr. Tong spoke earlier about the risk quantification should not actually be limited just to you as a healthcare professional and the healthcare team actually evaluating the patient's risk, but also involving the patient and making the patient aware how does this risk actually translate to, and how does it actually impact on them? What are the religious exemptions, and what are the potential misconceptions, not just with regards to blood glucose monitoring, also with regards to the treatment, and maybe also with regards to the latest treatments, which may be more and more in the recent years. Some of our diabetes patients may be started on either the oral GLPs, once the SGLT2s. So these are some of the things that probably needs to be discussed, or even bariatric surgery. So how about monitoring? You heard from Dr. Esther Yeo, who had gone into great detail about how blood glucose monitoring has changed tremendously in the recent years, and how CGM is something that needs to be used as a tool. So how can we actually help patients optimize during this period, before, during, and after Ramadan? And if there are availability of apps, how can that be included, encompassed in the overall management to actually help the patient improve the control even further and detect the potential hypo and hypers that have not been detected, all this while through just simple capillary glucose monitoring. We need to prepare the patients. How is that so? You heard Prof. Nisa talking about earlier about how the patients need to have adequate fluids, dietary advice, right? And that should not actually just be limited during Ramadan period, but probably to make it a habit and to make it something that patient is used to even prior to Ramadan period, in order to promote this as part of the overall self-management that starts before Ramadan, improves throughout Ramadan, and thereafter. We need to ensure that they continue to live actively and well, right? So the physical activity and exercise should be advised even before Ramadan period. Ensure that it's stable for them to go through Ramadan, and any form of prayers, increased prayers, both nighttime and for a lot of our patients daytime as well, how that can be included in their daily activities, and how you can actually continue to monitor this as well remotely via the various apps that's now available. How about test fasting? So we do know that medication adjustment and test fasting is what many of us now do during the pre-Ramadan assessment. But actually, it's not just a once-off. The patients need to continually adjust the medication, the treatment, as well as do test fasting, not just during the pre-Ramadan assessment, but thereafter, all the way to before Ramadan starts, and then throughout Ramadan, and actually even after that, because the fasting frequently does not just stop during the Ramadan period. We do know that glucose profiles improve throughout the Ramadan period, should improve throughout the Ramadan period, and potentially even after Ramadan, because quite a number of our patients continue to fast after Ramadan period. So medication adjustment is not just a once-off discussion, not just a once-off adjustment, but needs to be done throughout. And so this remotely discussing with the patient, contacting the patient through the apps, as well as through other means, including emails and other platforms, is potentially what needs to be done throughout, and not just as one period just for Ramadan. And also, of course, even more importantly, when to stop. As mentioned previously, we frequently keep talking about how glycemia is too uncontrolled for our patients, and hence it becomes a point that our patients do not actually realize that it's really not about hyperglycemia. Esther alluded earlier as well, that it's actually an issue about the best level that it should be at, not too low, not too high, and also how the amplitudes happen regarding the rise and the fall that actually need to be timely and match with the treatment. So how can they know when they need to break fast? How do they know how to recognize the hypoglycemia symptoms, which may be variable, which may be a relative hypo symptom? And how can they actually ensure that they do it timely rather than do not act when the sugars is not exactly at the hypo level yet, but can potentially be so if you see at how fast the glucose level are actually dropping when they are doing their FGM or flash monitoring or CGM. So as mentioned earlier, physical activity needs to be timely as well. We need to ensure that the patient actually avoid rigorous activity during the last hour of fasting, as Sueziani suggested that this is the period of increased hypoglycemia and dehydration during periods between noon to just before the meal break period. As well as they do need to ensure, as I mentioned earlier, that there is a level of physical activity that is stable prior to actually starting on the Ramadan. Just like the other talks that you've heard before, the stability of the treatment needs to be attained prior to the Ramadan period as well. Physical exertions, if they have not been actively doing a lot of prayers and doing a lot of exercises, then these need to be considered, as it may actually make quite a bit of changes in terms of their insulin sensitivity and their glucose levels during this period. There is enough data to show that there can be improvement in HbA1c targets and reduced weight with more nighttime prayers. So as I mentioned earlier, the medication adjustments for enduring fasting should happen throughout. At the point that you first see the patient and you know that the patient is going to go through Ramadan. It's not just for patients who are not frequently seeing because the control is really good. So maybe they are seeing only 4 to 6 monthly, but also for those who continue to need optimization throughout and may actually still be beyond their target control even prior to the Ramadan period. And how can you continue to do this? So let's talk about utilizing technology. Traditionally, there's a lot of data had already shown by Prof. Yaacob Ahmadani's group and a lot of the other groups as well, the UK group and others, that show that the Ramadan-focused patient education, when delivered in a culturally sensitive manner, either in groups, one-to-one, healthcare setting, or in the community, by healthcare professionals, or by trained community workers, can be as effective. And of course, it needs to be done based on the individual needs and targets. Why do I say so? Of course, in the different groups, say for example, in the minority Muslim populations, there may be language barriers, even in, say, patient groups with special needs, like those in sign language, there may be barriers. And hence, if we use other modes of delivery, this could potentially help to share the healthcare resources and provide and deliver the right resources to the right group of patients. So there are some recent data that suggests that not just that these are potential modes, but that it can actually be as effective as the traditional means. So face-to-face, so the patient education can be delivered face-to-face or remotely via apps or emails, messaging apps such as WhatsApp or Telegram, social media platforms such as Live on Facebook, or video conferencing. So in a study by Koger 2 years ago, 2021, it shows that this is a poster that was presented. This shows that diabetes virtual education was well received and improved glycemic control and self-care in type 1 diabetes patients during Ramadan fasting when delivered via WhatsApp. So patient was delivered a video and booklet, and it was delivered via WhatsApp. It's a small group of about 90 patients, quite proportionate in terms of gender, and the diabetes duration was about more than 10 years. However, you do take note that this is a younger population, right? Only about mean age of about 24 up to about 32 years, ranging down to about 16 years. So these are the internet and IT savvy group. It's not that most of them think that the video methods was very well done and acceptable. More than half of them actually use it as a reference, and actually most of them comply with the guidelines as recommended during the study, which was that almost 90% complied with the frequent glucose monitoring. 70+% actually reported breaking fast at the recommended threshold of 3.9. And this is definitely more than a lot of the other studies that was published previously. And only about 20+% actually broke fast when there is hyperglycemia. Not mentioned in detail whether these are during sick days or otherwise. And more than 60% actually followed the recommended insulin adjustments to basal and sahur doses and to the adjustment of meal timings, which is the delay of sahur, and as well as the fluid intake, which is basically what our DAR guidelines 2021 actually recommend. And about 2/3 actually complied with eating of proteins as our period. There's also slight improvement, but significant decrease in the glycemic control. Our online module, Dr. Rifai and Dr. Zainudin and group actually did a study on how do we actually educate our own healthcare professionals and whether virtual education is shown to improve knowledge as well as management of diabetes patients. So this is an online module that was implemented for pharmacists, both undergrads and postgrad students, to improve their knowledge, communication, and self-efficacy for proper care of patients with diabetes in Ramadan. So this actually shows that this group of pharmacists and pharmacy students actually improve in terms of the knowledge as well as the self-efficacy after the online modules. And hence, this is a potential way to cast a wider net in implementing online education for the healthcare professionals at large. Locally, we also did a small study on healthcare professionals with regards to virtual education when it comes to managing diabetes in Ramadan. For this, it was just a small group of nurses in our regular annual education. Most of the participants were practicing in inpatient settings. Most were actually practicing about slightly less than half, but 2/3 were practicing. 1/3 was practicing from medical wards. 80% were actually managing Muslim patients, but only about a quarter of them as per the Singapore's population. And about 80% were managing about 50% or less. About 50% had no prior education on the topic delivered. Please taking note that we already do a regular education on an annual basis. 60% were actually unaware of the effects of fasting in glycemic control and the risk of fasting. The elderly, 90% were aware of the restrictions of food and oral intake during fasting. But 50% were actually unaware that Ramadan lasts 14 hours a day. Assuming because it's local that we don't actually have the data regarding how long they have been in Singapore and all that, but I thought this was quite surprising that they are not aware about the restriction, the number of hours that Ramadan lasts, and also restriction on medication intake during fasting, and hence 90% would actually not counsel patients with regards to fasting because of the lack of specific knowledge, and they have not encountered patients with complications during fasting. So after the education, all the attendees were actually more confident in managing the diabetes patient during Ramadan period, although they are keen to continue to be supported by the specialist diabetes care team from the hospitals, including the dietitian. So this suggests that teleeducation, although this is pilot study and needs further data, it can be used as a virtual platform that is just as effective as the traditional healthcare education as a delivery method for specialty updates. So Prof. Disak and the other speakers earlier had also mentioned that if there is an issue about producing or providing materials for our local healthcare professionals, as well as for the local healthcare professional, as well as the patients, there has already a series of materials that you can use, and this can be delivered quite easily because it's actually available on the App Store and Google Play Store. So for the healthcare professionals, it's under the Academy, where there is a library of knowledge, videos, as well as other resources. And for the patients, there's also DASAFA, where the patients potentially can use this if they do not have the immediate access to the other diabetes care team members. Of course, it is best done together with at least the doctor who is in charge of the patient in order to guide the patient further. So likewise, it is also available online. As mentioned earlier, the latest guidelines in 2021, the Ramadan Nutrition Plan, the DA Academy app, and the Safa app can be, the links can be obtained from the website. So, we know that harnessing technology can come in various ways. We have heard and we are well aware that we can educate the patient via teleconsultation, monitor the patient via telemonitoring and teleeducation. We can also provide virtual education and provide remind alerts and guide to medication adjustment via the various apps available. In the community, there are various social media platforms that can be used as well, and educational videos that can be provided through the social networks. And there is definitely enough evidence that now there is increasing evidence that it can be used and will be just as effective, not just in diabetes care, but also in the more recent data in the context of Ramadan. But more and more studies and larger studies needs to be done to continue to evaluate this. So the role of diabetes care teams continue to be a role that is not just limited to the healthcare professional or the doctor that's taking care of the patient, but as a whole, with the doctor, the nurses, as well as the rest of the allied healthcare professionals, and the rest of those involved in the patient care. So not only do we need to continue to monitor the patient, provide regular feedback to the patient, information on the latest devices, the latest treatment available, and the safety during Ramadan period, but a personalized care management plan befitting the patient's particular lifestyle, their culture, their behavior, their beliefs will need to be catered for each patient. And hence, as a lot of the speakers have mentioned earlier, in certain groups, there may need to be more involvement of the healthcare professionals if, the community leaders and the religious leaders, if the healthcare professionals are not able to engage the patient into recognizing the needs or belief or understanding the misconception and risks peculiar to that particular patient. And as mentioned earlier, various modes of delivery can actually help to ease this casting of the net to a wider audience at this current age. So as a summary for pre-Ramadan education, we know that there are various key components for the safe fasting. At least the education should be done 6 to 8 weeks before Ramadan, but not limited to that. that's helped to improve glycemic control, weight, hypoglycemia, and the positive outcomes extend beyond Ramadan, should involve patients, family, and caregivers, which are not these families alone, but also various populations in the community. Needs to be culturally sensitive and targeted, can be delivered individually, in groups, face-to-face, remotely, and now increasingly there are various platforms that also shows evidently that it is just as effective. Various components need to be discussed and made aware for the patients with regards to the risks and the various components. These benefits, as mentioned earlier, should be ongoing and can be actually help to benefit the patient not just during Ramadan period, but long after as well, in terms of the nutritional intake, medication adjustment when they actually do fasting during or after Ramadan, or even at other kind of circumstances, as well as the healthy lifestyle that can be a guide for them. So special thanks to all the diabetes care teams in Singapore, actually regionally as well, because we are also doing some studies with regards to teleeducation in the region, as well as ANS chapter, who are the co-sponsors for this conference today. So wish you all a Ramadan Mubarak, and contact number is there for any further clarifications needed. So I look forward to the panel discussion.